Sorry for being a little late. Now we can continue our super all-in-one vlog for all who want to lose weight. Where did we finish? Okay. BMI shows us we have obesity. Let's talk about it. 2.3 Has obesity become an epidemic? According to the World Health Organization, worldwide obesity has more than doubled since 1980, and in 2014, there are about 2.1 billion, nearly 30%, obese people in the world, including adults, children, and adolescents. More than 1.9 billion adults, 18 years and older, were overweight. In 2010, obesity and overweight were estimated to have caused 3.4 million deaths, most of which were from cardiovascular causes. Obesity-related illness, including chronic disease, disability, and death, is estimated to carry an annual cost of $190.2 billion. Most of the world's population lives in countries where overweight and obesity kills more people than underweight. These numbers describe a tragic public health situation. Being overweight increases a person's risk of serious illness. A very large, and growing, percentage of citizens are at increased risk for developing serious chronic diseases, and face the prospect of early disability or death as the result of being overweight. Meanwhile, the entire society struggles under the burden of the resulting increase in health care costs. 2.4 What can obesity lead to? Obesity can lead to other illnesses from chronic to acute, some very severe and deadly, such as diabetes, high blood pressure, coronary artery disease, coronary vascular disease, heart attack and stroke, cancer, gallbladder disease and gallstones, osteoarthritis, gout, breathing problems, such as sleep apnea, when a person stops breathing for short episodes during sleep, and asthma. All of these diseases are very preventable if one can educate themselves and learn to be more careful with what they eat and how much physical activity they do. 4 of the top 10 leading causes of death are all related to obesity and are direct causes of obesity. 2.5 What are the physiological consequences of being overweight? The most common diseases associated with high BMI are increased blood cholesterol. As a result of consuming large amounts of saturated fatty acids, the concentration of cholesterol in the blood increases. Obese people, mainly with abdominal obesity, are often elevated levels of bad cholesterol (LDL) and decreased good cholesterol (HDL). Hypertension. Blood. The occurrence of hypertension and complications associated with it is threefold higher in obese than people with normal weight. To ensure blood flow, increased body weight, the heart must work harder to perform, and the cardiovascular system must overcome more resistance tissues. Even a small reduction in weight can significantly prejudice the lowering blood pressure. Coronary artery disease. Obesity is the third most important risk factor for coronary heart disease after age and elevated cholesterol. Research shows that in 40% of cases this disease is associated with overweight. The cause of coronary artery disease is atherosclerosis, cardiac and vascular hypertrophy of the heart muscle. Being overweight increases the risk of serious death from coronary heart disease. Atherosclerosis. Excessive amounts of fats consumed by obese people are put off not only in the form of fat, but there is also a source of cholesterol, which is then deposited in the walls of blood vessels. Stroke. Obese individuals often get a clot in the blood vessels, causing a stroke. Cholelithiasis. In overweight people, bile secreted by the liver is more concentrated as the result of eating more fat, and it favors the formation of stones. Diabetes. In patients with abdominal obesity, diabetes is the most common disease. Type 2 diabetes is a condition dependent largely on the diet. The research shows that 80 to 90% of obese people suffer from type 2 diabetes. Insulin promotes weight gain in the body, which enhances the metabolism of glucose. Osteoarthritis. Excessive body weight causes excessive load and damages mechanical joints. Damage to knee joints is most concerned. It also severely affects hip and vertebrae. Obesity can lead to worsening pain and swelling. Too high body weight increases the load on the lower spine and the extremities. Lower back pain. Obese people often suffer from permanent or recurring back pain. Through too much weight gain, abdominal muscles are forced to sustain severe upper body parts. The result is an increased emphasis on the lower parts of the spine and its pain. Shortness of breath, breathlessness, respiratory disorders. Obesity causes breathing problems due to the mechanically restricted mobility of the chest. It leads to reduced oxygen saturation. Threatening complication is sleep apnea. Obesity often causes shortness of breath during physical efforts. This is due to the influence of body weight to work the diaphragm and a large load of the heart. Tumors. Obesity increases the likelihood of cancer in both women and in men. Women have an increased risk of breast cancer and endometrial uterus due to the fact that these cancers are caused by excess estrogen. Estrogen produced in adipose tissue, and if more estrogen is released into the body, it will ultimately lead to a tumor. The threat is particularly high in postmenopausal women. Death. Obesity not only impairs health and reduced quality of life, but it also shortens life. Numerous studies show a correlation between body weight and the risk of death due to obesity-related diseases. The longer obese, the greater is the risk of death. 2.6 What are the psychological consequences of being overweight? Modern culture is singular in the way that it worships youthful, slim, toned bodies. With rare exceptions, only thin, proportional bodies are considered sexy. Obese or overweight people are looked down upon. It's easy to feel bad about oneself, to become depressed or anxious, or to develop obsessions around eating control when one's culture makes it clear that the way one appears is wholly undesirable. Psychological consequences of being overweight or obese can include depression, anxiety, low quality of life, low self-esteem, body dissatisfaction, emotional eating, poor concentration level, poor academic success, loss of energy, loss of joy of life. Studies have shown that obese children rate their quality of life lower than those children with cancer. 2.7 What are the social problems of being overweight? Obese people find it difficult to face social gatherings because lots of people taunt and poke fun at obese people. Obesity becomes a social stigma and people take obese people useless, and in reality, obese people cannot perform several tasks that other people can. Social problems of being overweight includes social exclusion, fewer friends, lower education attainment, lower employment, more bullying, discrimination, less likely to get higher education, lower salary, less likely to marry, more likely to divorce, more likely to commit suicide. Due to social problems, they become alone and hide in their cocoons. It needs lots of confidence to face the world with obesity. 2.8 What you will gain by becoming healthy? Weight loss isn't just about going down a dress size or two. It's about improving your life in dozens of significant ways. Losing even a small amount of weight can lower your risk of health problems. There are definite health benefits that overweight or obese people can gain from losing some weight, for example, better sleep, better hormonal balance, improved sex drive, increased sexual performance, better mood, less joint pain, clearer, brighter skin, stress relief, more money, more friends, fewer colds, improved memory, better wardrobe, food will taste better, fewer prescription medicines, plummet intolerance, lower risks of cancer. These and much more are the reasons that will make you proud of every pound you will lose. Conclusion. Remember this thing: a leaner you equals a longer life. Meaningful change takes time. Be sure to keep your non-scale victories in sight, and consider all the ways your small improvements have already done your body good. No funny vlog we made today, but by me, very stimulating to do something. But what to do? Sue, interesting? Wanna know? Subscribe with ring bell, and you will never miss the other parts. Continue will be, I think, tomorrow. I hug you.